I'm Dr. Lanalee Araba Sam. I'm the Medical Director of Elite Obstetrics and Gynecology in Fort Lauderdale, Florida. I've been practicing medicine for 17 years. I've been in Florida for 13 years. I am the proud mother of a 10-year-old son, Shane Alexander McFarland. You may have noticed that his initials are Sam. And I love what I do. Obstetrics and gynecology was not something that I intended to do. My father's an OBGYN, and I actually tried not to become an obstetrician because of the fact that I saw how challenging that life was for him. But in my third year of medical school, I did my first delivery, and I fell in love. I called my dad. I said, "Dad, this is the greatest thing ever. Why didn't you tell me how fantastic this practice was?" And my dad's response at that time was, "Call me in 20 years, click." Well, you know what? I've been practicing now for 17 years as a physician, and I still love what I do. The opportunity to bring life into this world is incredible. To be part of that moment where I'm delivering a baby, a fresh soul onto this planet, is still an honor and a privilege to me. My favorite part of my job is the moment that I deliver that baby. And I get the opportunity to see this child that myself, my patient, her partner have been tracking since our first ultrasound at 9 millimeters, now to 9 months and a 7-pound, 8-pound, 9-pound baby in my hands. That moment of completion is priceless. My own pregnancy and delivery of my son 10 years ago changed me absolutely as a physician. It made me better. Prior to having my son, at the age of 36, so I was advanced maternal age, and I had delivered thousands of babies prior to my son. And I'll tell you that again, the experience of being pregnant for 9 months, of feeling the baby move inside of me, of all the anxiety of the hormonal roller coaster, of non-stop nausea, vomiting during my pregnancy, made me so much better as an obstetrician. I actually, after I delivered my son, wrote a letter to all of my patients talking about how much more I understood now that I've had a baby myself. My philosophy about pregnancy and birth is that it is not a pathology. It's a natural process. Guess what? People have been doing this for a few million years, and that is one of the #1 things that I'm going to reassure and talk to my patients from the very beginning. I believe that we work together as a team to get the best possible outcome, which is a normal, natural, wonderful experience at the end of this pregnancy journey that we would take together. The fact that pregnancy is so unpredictable, that it's a long 9-month period of uncertainty and anxiety, is the reason that I advocate my concierge pregnancy, because I guarantee that I'm the one that they can reach out to at any point, that I'm the one that's going to answer the phone when they call with a question at 2 o'clock at night, that I'm the one that will be there with them in the hospital during their labor at the most critical point when they're delivering. They know that I will be the one that's holding their hand and delivering their baby.